serves a similar but a slightly different constituency. But I want to ask each of you if you see people or groups of people, specific people, who you see are falling through the cracks as a result of some of these cuts and as a result of the way that the state is handling its Medicaid waiver. John, are you seeing people fall through the cracks?
Well, statewide, we have this huge waiting list, and it's really easy to see folks that have been waiting 10, 12, 15 years. And imagine you're 75 years old and you find out you now have to wait 15 years. It just becomes unimaginable. And that 75-year-old parent is probably a single parent and has a 50-year-old son living at home with them. So we have a huge need. And I think David and Maureen both raised some really good points. And one I just like to pick up on. These are hard choices because we have the two biggest issues in the state budget are K through 12 education, and secondly then Medicaid. So that's the two big pieces on the table. We've got to figure out a way to not just do more cuts like this, but get real reform in the system. A lot of the things that Maureen could do to help people, we can't do because of rules. Specific example, we have mountains of paperwork they have to do, counting people every hour, what they're doing during the day. That's useless time spent when we could be working with folks. Secondly, because of some of the federal rules, we're now prepared to spend about $55 million in Indiana to update our Medicaid computer system to make it more HIPAA compliant or more private. Could we not put that off for a couple of years while we're doing really necessary services for folks instead of just upgrading our computer system? Well, federal government says, well, we decided we're going to do it anyway. I think these are the kinds of choices we've got to provide instead of just saying, oh, cut another 7% or eliminate something.
And the other part, as the choices are made, as John said, you're competing with K through 12 funding. And down at the legislature, you got to think about who has a stronger voice. The parents of kids who are going to school or people with developmental disabilities. And it's very hard for them to come to the State House. They're a very often stigmatized minority. And that's unfortunate that people, you know, who have the right have the greater influence don't necessarily have the greater needs.
Is that something that's forgotten about in the state legislature? Because one of the problems that was cited with the IBM privatization of the FSSA, for instance, is that you can provide all the web-based services you want, but some of these people don't have internet access, don't know how to use a computer. It seems to me that smacks of the same problem you're talking about with lobbying the legislature on behalf of those with disabilities.
Yeah, I was at a conference that we were talking about giving advice to people with disabilities how to come down to the legislature and advocate. And somebody who is hearing impaired, deaf person, said, you know, I go on the web and I try to watch the proceedings, but there's no closed captioning on the website. I can't figure out what's going on. And I was stunned to find that out, and I'm going to do what I can, because we should have that. I mean, you turn on any TV and any network and you have closed captioning, and that our legislature doesn't. But yeah, you know, and this ties back to the point about the Americans with Disabilities Act. When you go to the legislative history, one of the things they pointed out was that a lot of the discrimination in our society against people with disabilities is not sort of the, we dislike you, the hostility, it's neglect and indifference. People just don't think about the way our society is tailored to able-bodied people and doesn't take account of the needs of disabled people, and we make that mistake over and over.
Maureen, are there individual groups of people in Monroe County who come to Stone Belt who we might not ordinarily think of as being people who would sort of fall through the cracks, or people who would be unordinarily disadvantaged, who you think should have a voice as being people who need to be served better by the state?
Well, in our Milestones division, which is our mental health division, we see children with developmental disabilities who have mental illness or they have behavioral disorders. We have psychiatrists, we have behaviorists, and we have therapists. And it's not unusual to meet a family that has a child who's in the school system getting special education, but that child is on the, may or may not be on the waiver waiting list. So we facilitate that. We tell them, we resource them, tell them where they can go to get on the waiver waiting list. But we also have to say, there's 22,000 people in front of you And the likelihood of your son or daughter getting waiver services as a child, and particularly right now when they need them, is very, very small.
Do you find that number daunts some people away from even signing up?
Absolutely, absolutely. They get very, very discouraged. And when they go to sign up, someone else will say, do you know that there are 22,000 people on the waiting list? And in other words, you're not going to get immediate help from this. This is help that you might be able to get 5 years, 10 years, 12 years, or 15 years down the line.
And here's another point. We keep talking about the waiting list. There isn't a waiting list to get onto Medicaid if you're a single parent with children, you need health care. There's not a waiting list when you're 65 to get into Medicare. These are entitlements, and rightly they are. We don't give this entitlement for people on the waiver who are disabled, and they should have the same entitlement to the care they need that other people get. And this is a big failing of the Medicaid waiver, the way it's structured.
David's absolutely right, if I could, Stan, because I think part of what we were hoping under healthcare reform that didn't happen, that we're now hopeful will move into the next round of that, is that we should make the basic home and community-based services part of the Medicaid program that you don't wait for, because it's so good about preventative efforts. We have one of the highest out-of-home placements rates in Indiana for children with disabilities. If we put more preventative help with the family, we would save literally millions of dollars a year, because we wait till it gets so bad and then we'll place the child somewhere. So we're hopeful that as they continue to look at healthcare reform, and I agree 100% with David that this should not be something that you wait for, but those kind of preventative screening and assistance in the home that Maureen's so familiar with can be life-changing for decades, as opposed to waiting until something terrible's happened and then we spend money for the rest of their lives. And that's where real economic reform will come into play, because we'll be saving money by doing preventative activity as opposed to lifetime care. You
mentioned the healthcare reform bill. Do you believe that even though a lot of its provisions aren't coming into play until 2014 for some people, is that piece of legislation, assuming a challenge levied by attorneys general from Indiana and other places doesn't go through, could that help the Medicaid situation in Indiana and indeed across the country?
Absolutely, and David's a much better expert on this than I am, but just 4 quick things. And our healthcare reform is such a massive undertaking that the 4 years will go by very quickly. But it's going to extend Medicaid to people that are the working poor, that work in jobs that don't pay enough to buy insurance, don't provide benefits, and those are folks that are denied access to healthcare. That's key. Unfortunately, that's going to include some of the people that work for some of our community agencies, because our rates of pay are there so low because we don't reimburse the programs. The second thing it's going to do is push prevention. And we have people with disabilities that, women that don't get mammograms because we just don't provide it. So then we pay a lot more for cancer care later on instead of doing preventive care. Third area is it's going to put some long-term reforms into place that I think will drive down costs for everybody by bringing young people into the program and getting insurance. And I'm hopeful that some of the suits and more obstructionist things will get by the wayside. And at the end of the day, David talks about Medicare. Probably the single most important thing we did in healthcare reform in the previous 30 years, I think we'll look back in history and say this was another monumental turning point. And I don't know what David would be.
Now, John's right. In a lot of ways, this will be good. I suppose the danger is, as the healthcare legislation forces the state to expand other parts of Medicaid and spend more money on the working poor who need health care, will that now result in longer wait lists for the waiver and the parts of the Medicaid program where they aren't required to make the expansions? So that would be things we have to be careful about, that we're not pitting one Medicaid beneficiary against another potential Medicaid beneficiary.
Well, and especially with the younger children and families, some of the calls I get, it's not just that the child needs services, the family's under enormous stress. The parents calling, if my son or daughter gets suspended or expelled from school one more time, I'm going to lose my job. Where can I go? What kind of services can I get? What kind of help can I get? And we're talking about, I think, some fairly limited respite services, behavior supports, mental health supports, some family therapy, that would go a long, long way for that family to alleviate the particular acute problem that they have. And as John mentioned, you know, if this child continues to have mental health issues that aren't addressed and behavioral problems that aren't addressed, and the family doesn't know what to do, that leads to acute hospitalization, that leads to long-term residential placement, which is much, much more expensive in the long run than some of the programs that we're talking about and proposing and saying, you know, I could probably name 100 families right now that have come into our Milestones office over the last year or two that could benefit from these kinds of services. It would be very, very helpful, preventative. It would help the school system. It would help the family's economics. The long-range benefits are enormous.